Good afternoon, all of you. Welcome to my channel. Please subscribe to my channel for new videos. And as we're all discussing about the triangles of our body, we have come to the lower limbs. In the lower limbs, we are going to identify a triangle called as femoral triangle. So this femoral triangle, which is present in front of the thigh, strictly speaking, the proximal aspect of the front of the thigh, we can identify the triangular area. Let us discuss about it. So here you can identify the femoral triangle. It is present in the front of the thigh, the proximal aspect of the front of the thigh. We can identify the triangular area, intermuscular space called as the femoral triangle. Let us discuss about the boundaries. The boundaries are laterally we can identify the medial border of sartorius, and medially we can identify the adductor longus, medial border of adductor longus. Base is identified. Base is formed by the inguinal ligament. So the lateral boundary is formed by medial border of sartorius. Medial boundary is formed by medial border of adductor longus because it is a rounded muscle. The belly of the adductor longus is rounded. So the medial boundary is formed by the medial border of adductor longus. The base is formed by inguinal ligament. So here you can see the lateral border of femoral triangle, which is formed by the medial border of sartorius, and here you can identify the medial border is formed by the medial border of adductor longus, and this is the base is formed by the inguinal ligament, and apex is which is projecting down where the medial and lateral boundaries are meeting with each other. Then moving to the floor contents. So floor is formed by lateral to medial. First one is iliacus. Then medial to the iliacus, you can identify the psoas major muscle. Then medial to the psoas major, you can identify the pectineus. And medial to the pectineus, you can identify the adductor longus. So the adductor longus itself, it is forming the medial boundary, and also it is involving in the formation of the content of femoral triangle. So remember the contents from lateral to medial. So iliacus, medial to the iliacus, psoas major. Medial to the psoas major, we can identify the pectineus. Medial to the pectineus, we can identify adductor longus. So these are the floor contents. And now what are the main contents of this femoral triangle? Let us see. So the contents which are present in the femoral triangle from lateral to medial are nerve, femoral artery, femoral vein, empty space, and lymphatics. To remember the contents of the femoral triangle, I'm giving you a mnemonic called as navel, N-A-V-E-L. So most laterally you can see the femoral nerve. Then in the femoral sheath you can identify femoral artery and the vein. Then E stands for the empty space, and most medially we can identify the lymph nodes, the deep inguinal group of lymph nodes. They are called as cloquet group of lymph nodes. So these are the main contents of the femoral triangle: femoral nerve, femoral artery, femoral vein, and here you can see the cloquet group of lymph nodes which are present most medially. So this cloquet group of lymph nodes, they are draining the lymph from external genitalia, strictly speaking from the glans penis in the case of males and glans clitoridis in the case of females. If any infection is present in the glans penis or glans clitoridis, we can find the enlargement of deep inguinal group of lymph nodes. Yes, in this dissected specimen, we can identify the boundaries clearly. This is nothing but the lateral boundary, sartorius, and this is nothing but the medial boundary, adductor longus. And here you can see the inguinal ligament. And most lateral, you can see the femoral nerve, femoral artery. Artery is present medial to the nerve. Then this dark color one is nothing but the femoral vein, which is present medial to the femoral artery. So the deep branch which we can identify here is nothing but the profunda femoris artery. So that is about the dissected image demonstration on this femoral triangle. Now coming to the clinical aspects, the femoral hernia. Femoral hernia is a common thing which we can identify. If the hernial sac is present below the inguinal ligament, and it is different types. If the hernial sac is present in front of the femoral vessels, that is called as prevascular hernia, that is called as Velpew hernia. And sometimes we can identify the hernial sac is present lateral to the femoral vessels, lateral to the femoral vessels. This Hasselbalch's hernia, which is passing through the directly into the Hasselbalch's triangle and comes outside and reaches to the front of the thigh. This is called as Hasselbalch's hernia. Then other type of hernia, if the hernial sac is present behind the femoral vessels, that is called as Seraphinis hernia or retrovascular hernia. Retrovascular hernia. If the hernial sac is present in the center of the triangle, femoral triangle, that is called as femoral hernia. And sometimes the hernial sac is present most medially just below the pubic tubercle. That type of hernia is called as Laguer's hernia. Laguer's hernia. And sometimes so the last type of hernia is Clockett's hernia. In this Clockett's hernia, the hernial sac reaches to the most medial part of the femoral triangle, where the deep inguinal group of lymph nodes are present. That particular hernia is called as Clockett's hernia. So these are the different types of hernia which we can identify in the femoral triangle. So that is about today's triangle. Thank you, dear friends. Tomorrow we'll see you soon with a new class. Till then, see you.